Hello and welcome to the ASCO Guidelines podcast, one of ASCO's podcasts, delivering timely information to keep you up to date on the latest changes, challenges, and advances in oncology. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Jyoti Patel and Dr. Natasha Lail, co-chairs on Therapy for Stage 4 Non-Small Cell Lung Cancer Without Driver Alterations, ASCO Living Guideline version 2023.3. Thank you for being here, Dr. Patel and Dr. Lail. Before we discuss this guideline, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The disclosures of potential conflicts of interest for the guideline panel, including Dr. Patel and Dr. Lail, who have joined us here today, are available in line with the publication of the guideline in the Journal of Clinical Oncology, which is linked in the show notes. So then to start us off on the content of this episode, Dr. Patel, this living clinical practice guideline for systemic therapy for patients with stage 4 non-small cell lung cancer without driver alterations is being updated on a regular basis. Could you provide some background information on the process for these living guidelines?
The ASCO Living Guideline offers continually updated recommendations based on review of systemic randomized controlled trials. We bring a panel of experts together that includes representatives from Ontario Health as well as ASCO, patient representatives, and we review phase 3 studies as well as other published studies between the times from July 2022 to October 2023 for this most updated guideline. We think about the size of the populations that are being tested, what kind of interventions we have, we look at outcomes. Certainly, we look at PFS as well as OS, but also toxicity and overall response rates. We prioritize randomized trials and really look for studies that have large sample sizes. We exclude studies that were only meeting abstracts and really look at those that are published in peer-reviewed journals. When we weigh the evidence, we really think about a number of factors. So what is the strength of the evidence? What's the sample size? And how can we make recommendations for our patients based on the totality of the data? Certainly, because this is such a rapidly evolving field, one of the things that we're looking at is how to update in real time these guidelines. And so for this coming year, for example, these guidelines are published. We look forward to quarterly updates and again, incorporate the latest evidence.
Great. Thank you for that explanation on the background and how these living guidelines are developed. So then, Dr. Lail, could you describe what the key changes are from the expert panel?
So what we tried to do in the guidelines for this latest publication was really try and streamline the way we set up the format to make it much easier for people to use. In terms of new recommendations, we've made sure to include more recent studies of additional PD-1 or PD-L1 inhibitors, for example, cemiplimab in combination with chemotherapy, or the combination of durvalumab, tremelimumab with chemotherapy, both of these in unselected patients, so with any PD-L1 expression. Of course, this continues with pembrolizumab, with or without chemotherapy, atezolizumab with chemotherapy combinations, and of course, nivolumab and ipilimumab with and without chemotherapy. And so it really is just an update on all of the potential options. And in the discussion, we've really tried to go through some of the nuances in the trials just to help when you're discussing with patients or if you're discussing with your oncologist, how to figure out which of these is best for you.
Excellent. It's helpful to have all of the recommendations listed out together so that clinicians and patients know all of the options that are available to them. So then, Dr. Patel, what should clinicians know as they implement these changes into their clinical practice?
I think it's important to stress that our decision-making in the treatment of advanced non-small cell lung cancer is really reliant on adequate biomarker testing. And so the way we've approached this is our assumption that all appropriate patients undergo molecular testing and have PD-L1 testing to help us get the best therapies. And the other assumption is that patients and physicians are engaging in dialogue to better assess patient preferences, to have a better understanding of performance status, for example, as we think about allocating therapy. One thing that we've been able to do is to take the evidence and break it up by histology as well as PD-L1 expression, again, for patients who don't have driver alterations. And based upon that, think about the toxicity data with, for example, dual immunotherapy versus chemoimmunotherapy for subsets of patients. And so hopefully give some guidance to clinicians as they're going through this process. The other part of the guideline was to once again look at second line and subsequent therapies. So again, for patients who get immunotherapy alone, a recommendation is that patients get a carboplatin-based doublet in the second line setting. We still don't know if patients should get immunotherapy after that initial exposure. That's the subject of ongoing randomized studies. We also have stronger evidence than ever that docetaxel is an appropriate second-line agent, but there are other options there. So docetaxel and ramucirumab, as well as other single-agent chemotherapies.
Understood. Those are key points for informed and shared decision-making and are helpful for clinicians to know. So then, Dr. Lail, in your view, how will these guideline recommendations impact patients with non-small cell lung cancer without driver alterations?
Thanks. So we're really hoping that with all of the focus in the first line setting, that more patients will receive immunotherapy with or without chemotherapy in the first line setting to really bring it forward and really make sure that patients can start benefiting as soon as possible. As Dr. Patel said, one of the challenges, of course, is to understand who might benefit most with a chemotherapy-free approach and have treatments in sequence versus who really needs everything together. And so we've really tried in the discussion to try and help with that discussion, both from a provider and a patient perspective. So we want more people to get immunotherapy to help improve their outcomes and also to potentially get it earlier. I think that the other thing, and Dr. Patel has brought this up, but when we looked at what happens after first-line therapy, we really have very limited recommendations. And so it's our real hope that this will spur the community on to do even more studies to help us figure out what's next and how do we really improve outcomes for our patients after all of these great first-line options have stopped working.
Absolutely. I appreciate you touching on those key points for improved outcomes for patients with non-small cell lung cancer. So then finally, Dr. Patel, you've mentioned some ongoing randomized clinical trials, and so has Dr. Lail. So what are the ongoing developments that the Living Guideline expert panel is monitoring for future updates?
So we'll continue to update guidelines based on available literature, but certainly there are a number of trials that should be reading out in the next year or so, looking at combinations of immunotherapy and the second line setting, certainly comparing novel agents to docetaxel in the second line setting, so things like antibody drug conjugates. So certainly that's evidence that we hope to incorporate within the guideline, again, with the idea that we can really help clinicians and patients recognize or at least identify the best options for treatment for them.
Definitely. Well, we'll look forward to the expert panel's review and interpretation of this evidence as those trials read out, and appreciate all of your work on this guideline update. And we'll hear more as these guidelines are continuously updated. So thank you so much for your time today, Dr. Patel and Dr. Lail.
Thank you.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast. To read the full guideline, go to www.asco.org/living-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app available in the Apple App Store or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.